So we talked tonight about continued confidence as we're sitting here on August 16th, very near the beginning of the 21-22 school year. And again, I sound notes of confidence despite some of the things that we're still contending with, and a situation public health-wise that is challenging to us and which we remark and note is one of the worst public health situations maybe we've seen in recent months through the pandemic. We're approaching levels of transmission and spread and disease that are rivaling what we saw at the beginning of the holiday season, at the end of the fall, going into the winter. So we have those concerns, but we have lots of opportunities, lots of lessons learned, and lots of things working in our favor this time around too. So I always start these presentations, and I'll do it quickly this time, of course, with this diagram sort of talking about the different realms in which we do our work as we face the pandemic. And I'm happy to report this year with all of the various guidelines and guidance that we have, mandates that we have, that education and wellness of our kids are at the forefront. And the public health stuff that took such center stage last year, while still important to us this year, is giving us room to talk about, the education and wellness imperatives that we have as we move into this school year. And this is a unique year that we're moving into, certainly. I have to go through a few nuts and bolts here on talking about how some of the regional classification works and how there are differences between some of the schemes that are being presented to all of us as we try to understand what's going on in our county. There are basically two different grading criteria that we look at to determine how things are going with regard to COVID in Hunterdon County. The CDC has a measurement of how well our county is doing, and the Department of Health here in New Jersey has a separate measurement for how well our county is doing. And we need to talk about those differently because I hear people talking about them interchangeably, but they're very different. So the CDC has 4 levels, blue through red. And they base the level that they assign to each individual county across the country on the positivity rate, so how many tests come back positive for COVID-19, and the total number of new cases out of 100,000. So that's a measurement that is a total over 7 days. So if you have a bad day in your county, it works right into the total as a sum rather than as an average. Under the CDC framework, we are red. We're the highest level in terms of transmission. And that's based on those 2 metrics primarily. What's the positivity rate of tests and what's the total number of new cases? The interesting thing about this metric is it seems to be that if one of those is high, that's the grade you get. They don't sort of average out. That's what it seems to us. It's never been explained to us that way, but that's what it seems to look like to us. Now, the Department of Health has their 4 levels, and these are the ones that we've always used. These are the ones that we've been using for the past 18 or so months to understand the spread of the disease in our region. They also have 4 levels, green, yellow, orange, and red. This is based on 3 separate metrics, and those are averaged together, which is an important difference and a key difference in one particular way here. So positivity rate, again, same as the CDC. Hospital activity, so they measure COVID-like illness diagnostic codes coming out of our community health systems. So that's a metric here. How overwhelmed or underwhelmed is our hospital is a metric here that's important to the Department of Health's metrics. And average of new cases out of 100,000 over the past 7 days. So an average of new cases as opposed to a total of new cases presents a very different situation. If you have a bad day and you're averaging, that works out different than if you have a bad day and you're adding all of those days together. It works out a little different. And so we tend to look at the DOH thing and note that it seems to be a little more forgiving, if that's the right word. We seem to be at a lower level generally with the state metric than with the CDC metric. A couple other differences. There's the CDC metric is down to each individual county. The state metric is 3 counties, in our region, Somerset, Mercer, and Hunterdon. And then also the timeliness of the data is important too, where the CDC is generally updated pretty regularly. The Department of Health ones are generally lagged by about a week. So it's tough to nail down where you are on any given day, which is why we've made such progress and had to make such progress in partnerships with our local public health and medical communities to understand on a day-to-day basis what things look like. So we're yellow under the state metric. And that's important. That difference is important. So we are only the second level up in the state metric. Again, that data is a little old. We're approaching orange potentially. So we could be moving into the third level here of orange, which is where we've been at different times last school year. Whereas in the CDC metric, we're all the way up to red. So I wanted to share this because people talk about us being in red or being in yellow or this is what they're talking about. And sometimes those conversations are using these things interchangeably. We are in red, we're also in yellow. We're in red under the CDC's metric, we're in yellow under the state's metric. So that's the difference. So schools have been trained over the past 18 months to use the yellow the yellow Department of Health metric. That's the one that we've based all of our decisions on. That's the one that all of our guidance is based on. The CDC one is still new to us. So everything I'm going to talk about tonight is still keyed to the state metrics in which we are still yellow. Okay, so that's an important thing to say up front, as much nuts and bolts as that is to front load. I do think it'll become clear as we go through it and I talk about some of the different contingencies. So safe return planning, back in June, I talked about this. We have 8 areas in which we're required to plan based on our acceptance of federal funding. So I'll go through those very quickly. The first area is universal and correct wearing of masks. And of course, the thing to point out right at the outset here is that Governor Murphy issued that executive order on August 6th, which requires us to start the year masked indoors. Now, it's a requirement. It has the force of law behind it. There are certainly ways to advocate for or against the thoughts of this executive order, but outright defying it is not an option for schools in New Jersey. And I just want to make that clear that that's not an option for us. We have no option to just not do this. Once this lifts, though, we will like to get back to our initial thought about this school year, which is if we're in green and yellow, we'd like to allow families to decide on masking with the strong encouragement that we've heard from our public health partners to share with folks who are unvaccinated that they should mask. However, and we'll talk later in our vaccination section, vaccination status is not something that we are planning to inquire about or we're not planning to require the vaccination unless mandated to do so. So if we can get ourselves out from underneath this mandate and we can stay in a solid public health situation in green or yellow on the state's grading here, we hope to be able to get back to a masking posture that's more flexible. Distancing and cohorting, we are committed to all students being on campus every day, all day. And that's a priority we're getting from the state government. And to the degree that the state government is even saying, don't take other measures like distancing that get in the way of you achieving this priority. So distancing is important to us. We're going to maximize on distancing wherever it's practicable and possible. But distancing is not going to get in our way to meeting the goal of having everyone here all day, every day. We are allowed to have lunch. We weren't really allowed to have lunch under the distancing and masking rules of last year. This year, we can. And so distancing may be challenged in different corners during the school day, certainly will be, but we have some of those thoughts covered in some of the other steps that we have to take. And one of those steps is with lunch. Because of these requirements, we have to open the year with multiple lunch blocks. Sanitization and spacing require us to provide a lunch that is easy to keep in certain areas of the school. And the only way to do that is to split lunch into multiple sessions. We hope that we can get back to a unit lunch as soon as we can, but we simply must open the year with 2 lunches is what we're looking at to open the year. And then as we get further through the year, hopefully we can get back to 1. We do have contingencies as well, however, to go to 4 lunches if we need to, and we're hoping we don't ever need to do that. 2 is as far as really I'd like to go with splitting lunch up, because I recognize the value that unit lunch has for our kids as a break with each other in the day. So I'll be eager to get back to that. We are not planning to offer a program of full remote instruction except in those very limited circumstances where we're required to. And we are planning to put a lot of effort and a lot of resources into expanding off-hours tutorial services through Zoom and other other platforms for kids to be able to make use of. We're going to continue to use Google Classroom to keep things updated. So if a student has to go out on quarantine, for example, they'll still have access to teaching and they'll have access to the materials that they have to keep up with. We are not planning, though, to run cameras live from classrooms. That was a situation that we found ourselves in last year by necessity, but it really compromises our ability to deliver the kind of instruction that we want to deliver. That's something that I heard over and over and over again from our staff and from our students as well. We may have to talk about, if the situation gets bad enough, going back to a cohorting kind of system. That is, half the students come in on this day, half the students come in on that day, kind of like what we were doing last year. However, we're going to reserve that approach for only the highest levels of concern. So I don't see us going to that. I'm talking about levels of concern and spread that we never got to last school year. So we continue to prioritize, again, in the spirit of what's been delivered to us by the Department of Education and the governor, we continue to prioritize all kids every day, all day, and to a much more robust degree than the guidance allowed us to do last year. We're excited about that. Hand washing and respiratory etiquette, we're going to continue to offer hand sanitizing gel, at 60% at least alcohol. I believe that's the number. If I'm wrong about that, whatever the number is what we've got. We have hand sanitizing gel just about everywhere in all of our classrooms and gathering points and meeting points. We have buckets of the stuff. We're also going to continue the signage for our students and continue the messaging for our students. We do continue to believe that personal hygiene is one of the most effective ways to combat this virus, and that at the end of the day, how you're sort of keeping, how you're taking care of yourself and how you're keeping yourself clean is your etiquette in terms of sneezing and coughing. All of these things are important to helping mitigate the spread, just as important in some ways as some of the other steps that we've taken over the past 18 months, and some of which we'll continue to take as we move forward. Healthy facilities, we are going to have a heightened level of sanitization, not to quite the degree that we had through much of last year, although we're reserving that level. Everyone sanitizing everything every time they get up or sit down. That's something that we would revisit if we needed to, if the community spread in our local area got to the point where we felt that was necessary. But we are looking at daily sanitization. We're going to deploy units to clean the air and surfaces. We have one in the back here, or in the middle of the little theater here. We'll have those in all different places throughout campus, gathering points specifically like cafeterias and such, to keep air and surfaces clean. Our ventilation system, windows open, doors open, we feel that that's all going to continue to be effective to maintaining a healthy facility. We may require, as I said earlier, more heightened sanitization if we get up into orange or red on that state grading. That's when we could be considering, gosh, do we need 4 lunch blocks instead of 2 in order to create the sanitization scenario and the distancing that we need? We might also at that level have to think about limiting public access and even internal access to some of our facilities. Right now, we're hopeful that we can continue to offer our facilities to the community for all of the rec games and all of the uses and all of the community uses that folks have been used to before the pandemic. We're hoping that we can remain in a position where we can keep that going. Right now, we're open for business. If the condition in our community gets much worse, however, we may have to begin sort of tightening up a little bit. This is a room, for example, that's difficult to clean because of all the fabric and all of the carpeting. So this is a room that comes out of circulation when we start to reach a level of spread that's concerning. But we wouldn't be having those conversations until we got kind of deep into orange or into red. Contact tracing and quarantine, we have rules that we have to follow here, and there are requirements for folks who are close contacts to quarantine for a certain number of days, depending on whether they get a negative test or not. So we have to continue to follow all of those rules. And in this activity, we are looking to expand our are partnerships with outside agencies and part-time contact tracers who can take on more of that work for us. A lot of district administrators and nurses and other folks were involved in that work last year, and it got in the way of a lot of the daily things that they need to do to keep the educational program going. So we're going to have to continue to pursue some help from partners outside of the district to come in and do some of that contact tracing with us. It is important to note that students who are vaccinated do not need to quarantine if they are discovered to be a close contact of someone who is ill. That's the rule right now. And we have been seeing, as that becomes clear to folks, an increase in the number of vaccinations that the 12 to 17-year-old cohort seems to be getting over the past few months. I speak a little anecdotally on that based on what people are telling me, but I see some glimmers in the data of some increase in vaccination rates for that age group, as much as I can sort of tease that out of the way the CDC provides that data. COVID-19 testing. We've had a lot of conversation about testing, but testing is not something that we want to engage in as in our staff collecting samples, our staff administering tests. The kinds of tests that are most meaningful to us require sort of a more robust kind of sterilization context. And so the rapid tests that are easy to give aren't necessarily as informative to us as some others. So we're not planning, unless we're mandated to offer testing on site. If we're mandated to require testing for any particular person, then we'd be looking for partnerships with our local medical community to help us make that happen off-site. We're also hoping that we don't need to go back to our daily symptom-free assurance forms, though we would reinstitute those or look at reinstituting those if we climbed up into that orange or red level. We feel confident in green or yellow that we don't need that level of tracking. And vaccination, as we near the end here, we're going to continue to work with our partners to make vaccination available to folks who want or need it. But I am not planning, unless we're mandated to do otherwise, to require vaccination for staff or students for any opportunity or activity. I've talked about this before. The state of New Jersey has a well-oiled machine for requiring vaccination in schools. There's already a mechanism for requiring vaccination in schools. So for us to require it outside of that well-recognized process that's backed by the Department of Health and backed by law, I don't feel is appropriate for us. If folks feel that this ought to be a requirement, then it should go through the proper processes and land itself on that schedule for us to use it or to respond to it in the same way that we respond to all vaccination requirements. But right now we have no mandate to require it, so I'm not planning to institute one. I do want to point out that vaccination does allow for some things that, particularly in quarantining, that not being vaccinated doesn't allow. So as I mentioned earlier, if you're found to be a close contact of somebody who's ill, if you're vaccinated, you do not need to quarantine. If you're unvaccinated, you do need to quarantine for up to 10 days or 7 if you test out with a negative test by a certain point. So there are some things in the processes that allow for some more flexibility for those who are vaccinated. Lastly, accommodations for children with disabilities. As always, if any students have difficulties with any of the public health mandates that we have to follow or any of the things that we're doing, then we'll certainly work through our special education processes and other processes to allow exceptions and alternatives. So one of the things that we've done certainly is face masks instead of face coverings, the larger plexiglass face masks instead of the regular cloth mask. Face shield is what I mean to say. So we've used some of those in situations where, for medical and other reasons, students had to have an alternative to masking. In this also, again, I just want to reiterate, we are not planning a synchronous remote instruction program at the start of the year. And we're hoping that expanded tutorial, the technology that we have through Google Classroom and other platforms, and traditional home instruction will come to bear and be helpful for us if we need to carry anybody through a long-term absence. When you think about what 10 days of quarantine means, So if an unvaccinated student has to quarantine because they're a close contact of someone who's ill, they can test out under the current rules with a negative test at days 5 through 7. So now their quarantine goes from 10 days down to 7 days. 7 days out of school, let's put a weekend in the middle of that. You're talking about 3 or 4 absences, 2 or 3 absences from each class block potentially. And we feel like we can offer a lot of additional resources to carry that student through that absence without having to compromise the program in the room with live synchronous instruction with half the kids on the computer and half the kids in the room. Because again, we found that to be an unsustainable and really difficult proposition for our program in the classroom. And wherever there are questions from staff or students about accommodations, we always have. This isn't a new thing. We always have gone to our district physician. So we have doctors on the district's end who are working at verifying and weighing in on the medical necessity of any of those accommodations that are requested. So that's something that we have to do. It's something that I think it's important for us to do so that we have objective viewpoints throughout the entire process of the accommodation request. So we're looking at, I don't know if you can see this too well on the screen, but this will be available on our website as well. We're trying to lay out different scenarios for the different colors, and that's basically what's happening here. And again, this is based on the state system rather than the CDC system. The thing to point out here mostly is that this kind of summarizes things that I've said. You know, if we go to orange, then we're going to consider this, but in green and yellow, we're going to do that. And it looks at all different kinds of areas of activity, from lunch to masking, all the different things that I've talked about here tonight. The only thing that might be a new thing on here, you know, how we're going to deploy plexiglass barriers, how we're going to look at whether or not we have an expanded isolation room for students who might be ill or have symptoms or be close contacts. These are some more technical things that we have on this chart for us. But as we flesh this out, this will be on our website later this week. The thing to remember in all of this as I talk about the state system, and it's a point that I made earlier, the state system, the data in the state system is a little bit lagged. So right now, our situation is not, what our situation is right now is not going to be reflected on the state report until next week. You know, so we have a lag in the data there. We have really strong partnerships with our local public health and medical community to get much more timely information about how things are going. So the hospital is constantly letting us know what the situation is in the hospital. And that's important for us because that's the one metric we can never guess at from any of the other sources. We can find out the positivity rate. We can find out the cases per 100,000. Average and total, we can find all of that, but it's the hospital metric that we can never seem to get at. So the hospital tells us how they're doing. So we have good sources to get this information in a timely manner. So we can react even before we hit those colors through the partnerships that we have. The other thing to say too here is that this metric is averaged across Mercer, Somerset, and Hunterdon counties. And that's where, as we get into orange, there's a lot of this verb consider. Consider for lunch blocks instead of 2. Consider a daily symptom-free assurance form for staff and students. The consider in there is where we come down to what's the situation here in Hunterdon County in our immediate region. How can we tease that information out of this tri-county thing that we're getting from the state? What's going on here? And how does that give us flexibility? So our region might be in orange, but in Hunterdon County, we might actually be yellow or green if you just look at us. And in our immediate region of, you know, Flemington, Raritan, East Amwell, Reddington, you know, all in our immediate region, we may even be better off than the rest of the county. We've seen it come into the county from different directions through different spikes. So we have different ways to be more flexible than waiting each week for the state report on last week's data. And we're working closer and closer with our medical and public health community to zero in over what's the condition right here in Hunterdon County. The reason we want to do this with the state system is, again, is because the federal CDC system doesn't consider all the data that we think is important, like how's the hospital doing, or average of cases instead of total number of cases. There are some strikes against the CDC system that make it difficult for us to use as a gauge for these kinds of decisions. So we're blending different things here, but like I said, we've learned an awful lot of lessons. So we started here, we're going to end here, but I'm going to end here with gratitude because where we are right now compared to where we were at this time last year is a world away. Last year at this time, we were not sure we were going to open the school. Mr. Panico and I had some really tough conversations about where we were and what can we do. But we opened the school in a hybrid model. We didn't have a single long-term interruption to remote. And we're proud of that, even though it was not the full program that we would ever have wanted on any given day. We move into this year with a full program. We're confident that we're going to be able to maintain that. We're going to prioritize that. We're going to fight for that. And these other public health things that we have to do around the edges, and I know there's frustration about some of them. The other public health things that we have to do around the edges feel less important to me than what we've gained over the past year, which is all day, every day, all kids. There's a lot that we're going to struggle through over the next several months. But the prize at the end of it is not, we're going to open the school 2 days a week to dismiss at noon. That's not the prize. The prize is every day, all kids. And that's worth going through a lot of struggle for. So there's a lot more conversation to have about a lot of these individual things, but that's where we are at the moment in our planning, with plans to share more of all of this more broadly with the community this week. And away we go into what we hope will be, and what we're optimistic will be, a year that brings us closer and closer to the normalcy and to the high school experience that we all want for our kids and for our staff members and our community.